Imagine being on the operating table with death's shadow looming just inches away. The machines flatline, your body still, and all hope seems lost. But then, something extraordinary happens. Life returns, a heartbeat, a breath, and suddenly the impossible becomes possible. This is the story of one such miracle. A Christmas Day surgery that defied the laws of medicine and challenged my beliefs about life, death, and what happens in the moments between. I'm Dr. Lloyd Rudy, and for over 3 decades, I've dedicated my life to the delicate art of heart surgery. In that time, I've seen patients come and go, each surgery teaching me something new about the fragility of life. But one patient's experience on Christmas Day shook me to my core. This is a story not only about saving a life, but about understanding the unexplainable forces that guide us. It's a story about a patient who was declared dead and then came back. It was Christmas Day when Mr. Thomas, a 45-year-old man, arrived in the emergency room in critical condition. The cause? A severe oral infection that had spread, infecting his native heart valve. A seemingly simple infection had escalated into a dire medical crisis. As soon as I saw his medical chart, I knew this was no ordinary case. Mr. Thomas had what we call a native valve defect. This is a condition where the valve which regulates the flow of blood through the heart had become weakened, likely due to a birth defect or a long-standing condition that had worsened over time. His heart, trying to function despite the defect, had slowly started to fail. The infection had made it worse, and his valve was no longer capable of doing its job. He was in severe heart failure, and without intervention, his situation would quickly turn fatal. I gathered my team and informed them that this would be a high-risk surgery. We were going to remove the infected valve and replace it with a new one, but I knew we were facing an uphill battle. I was confident in our team's ability, but this was a surgery with serious complications. Even in the best of circumstances, there's always a chance things can go wrong. After hours of intense surgery, we successfully removed the damaged valve and replaced it. But as is often the case with surgeries of this complexity, things didn't go as smoothly as planned. Once we were done with the procedure, it was time to take Mr. Thomas off the heart-lung machine, a vital piece of equipment that kept his blood circulating during the surgery. But something was wrong. He wouldn't stabilize. His blood pressure dropped to dangerously low levels, and despite all our efforts to manage it, he continued to deteriorate. Every time we reduced the support from the machine, his condition worsened. After several attempts to stabilize him, I called it. We had done everything we could. I made the difficult decision to declare him dead. It's a moment that no surgeon ever wants to face. The moment when you must call time on a life that you fought to save. The anesthesiologist, following protocol, turned off the heart-lung machine and all the monitoring devices. The room went eerily silent. The beeping of the machines stopped, and we were left standing in the stillness, knowing that we had done all we could. I left the operating room needing a break. The weight of the decision weighed heavily on me, and I needed to clear my mind. My surgical assistant, however, remained in the room. He began closing up Mr. Thomas's chest with the intent to prepare for an autopsy. In cases like these, when a patient dies on the operating table, an autopsy is required by law. It's the standard procedure. My assistant closed the patient's chest, stitching up the soft tissues, but the monitoring machines were still running. The data, blood pressure, heart rate, left atrial pressure, continued to be recorded on paper. We were finished, and yet the machines were still running, and the paper was still spooling out onto the floor. We didn't bother to turn them off. I went to the surgeon's lounge to have a quick meal, my thoughts scattered with questions. Had we done everything right? Was there something we missed? I didn't realize, but while I was away, something truly miraculous was happening in that sterile operating room. About 20 minutes later, I returned to the operating room, my surgical assistant still there. As we were discussing the case, something on the monitor caught my attention. It was faint at first, but there was no mistaking it. A pulse of electrical activity. I stared at the screen, blinking in disbelief. For 20 minutes, Mr. Thomas had been declared clinically dead. His heart had stopped. His blood pressure had dropped to 0, yet here we were, witnessing something that shouldn't have been possible. The electrical activity grew stronger. It wasn't just a flicker, it became a steady beat, a heartbeat. I called for the anesthesiologist and nurses to return. We administered oxygen and some medications, but it was clear he was starting to stabilize on his own. His heart, which had been motionless, was now beating. His blood pressure, once dangerously low, began to rise. Within minutes it had climbed to 80, then to 100. His heart rate normalized, and just like that, he was alive again. We hadn't placed him back on the heart-lung machine. He wasn't receiving any medical support aside from the oxygen we'd provided. His body, on its own, had decided to fight. What followed over the next few days was just as extraordinary. Mr. Thomas made a full recovery with no signs of neurological deficits, despite his extended time without oxygen. But what really shocked me was when we spoke to him about what he experienced during the time he had been dead. He described a vivid near-death experience, NDE, something I had only read about in books. He spoke of a bright light at the end of a tunnel, a sensation of peace and warmth. But what stunned me even more was his ability to describe the operating room in detail. He spoke of seeing us standing at the doorway, arms folded, discussing what had gone wrong. He even described the post-it notes stuck to the monitor, something that no one could have known unless they had been in the room at the time. There was no way he could have known those details. He hadn't been awake, and he certainly hadn't been in any condition to observe what was happening. Yet he described it all as though he had been floating above his own body, watching everything unfold. "Dr. Reedy, I remember seeing you and your assistant standing at the door," Mr. Thomas told me. "I saw the post-it notes on the monitor. I saw the phone numbers written down, one after another. I even saw the string of notes sticking together as you added more information to them. How could I have seen that? How did I know about those details?" He went on to describe other things that only someone who had been in the room could have known. Details like the conversation between the nurses and the way the tools were arranged in the corner of the room. How was it possible for him to describe things in such detail when he had been declared dead for 20 minutes? "I saw you standing there, talking to my wife," he said. "I saw her looking at me, but she didn't know I was still there. She thought I was gone." These memories, these vivid details, defied all medical understanding. It was as though his consciousness had left his body and returned to tell the tale. A part of him had seen the operating room, heard the conversations, and felt the emotions of those around him. That moment changed everything for me. I had always been a man of science, of facts, data, and measurable results. I had always believed that death was the end, a finality that no human could escape. But Mr. Thomas's experience made me question everything. Could there really be something beyond our physical bodies? Was consciousness something that transcends the limitations of the brain? I began to think about all the other times I had heard of similar stories, stories of patients who experienced something beyond death. Many of my colleagues, other cardiac surgeons, had shared similar accounts. They too had patients who described floating above their bodies, watching themselves from a distance, and recalling things that no one could have told them. One thing became clear to me: there is something greater at play. I don't know what it is, but I do know that Mr. Thomas's experience was real. It was not a hallucination. It was not the result of his brain shutting down. It was something far more profound. In the end, what did I learn from this experience? What can we all take away from this story? First, I learned that life is more fragile than we realize. It can change in an instant. We take our health, our hearts, and our lives for granted, but in the blink of an eye, everything can change. Second, I learned that there are forces beyond our understanding, forces that cannot be measured by machines or explained by science. Whether we call it the soul, fate, or divine intervention, there is something greater than us at work. Mr. Thomas's recovery wasn't just a medical anomaly. It was a reminder that there is more to life than what we can see and touch. And finally, I learned that death may not be the end. It may be the beginning of something new, something beyond our comprehension. What Mr. Thomas experienced that day was not just a return to life, it was a glimpse into the unknown. And maybe, just maybe, that's the greatest lesson we can all learn. That there's always something beyond the horizon, waiting for us to discover it. As I reflect on that Christmas day, I am reminded that we are all connected to something greater than ourselves. Life, death, and everything in between are mysteries that science has yet to unravel. But perhaps the greatest gift we can give ourselves is the belief that there is more to this world than meets the eye. The miracle of Mr. Thomas's recovery will stay with me forever. It is a reminder that sometimes the most extraordinary things happen when we least expect them. And as we walk through life, we should never forget to look for the miracles that are hidden just beneath the surface.